What do you do to stay fit? Some play outside while others work out and strengthen their muscles in the gym. But what about your eye muscles, which you strain by working long hours on computer? For a great eye workout, we welcome you to the Eye Muscle Gym Clinic. I am Dr. Nisarga. In our clinic, we have so many patients who, after prolonged near work, complain of headache, watering, blurring of vision, and even jumping of the letters. On checking, their vision is absolutely fine. Even the anterior and the posterior segments give no clue. This brings us to the binocular vision anomalies, which are mainly classified as accommodation and vision dysfunction. Evaluation consists of refraction, sensory, motor, and orthoptic evaluation. In refraction, we must do a cycloplegic refraction, binocular balancing, and Bosch delayed testing. Sensory evaluation consists of Worth 4-dot test, in which patients wear red and green glasses, and based on number of dots seen, the patient can be classified as normal, having right or left eye suppression, or diplopia. Stereopsis can be measured by Titmus fly test. It is then followed by motor evaluation, which consists of Hirschberg test, in which we look whether the corneal reflex is central or not. The cover test is done to assess the presence of tropia or manifest squint. It is then followed by alternate cover test. In Maddox rod test, when the rod is oriented horizontally, the patient sees a vertical streak of light and we can detect the horizontal deviations. When the rod is oriented vertically, we can detect the vertical deviations. It is followed by movement of extraocular muscles, which are checked in all the 9 cardinal positions of gaze. Now coming to the orthoptic evaluation. In RAF ruler, when we bring the chart closer to the point where the patient sees blur, is called the near point of accommodation, while the near point of convergence is the distance at which the central dot becomes double. In fusional vergence, we use a base out prism, and when the target becomes blur is called the blur point. When it becomes double is the break point, and when it clears is the recovery point. We can keep the prism with the base in and note the blur, break, and the recovery points in the same manner. To measure the negative relative accommodation, we add the plus lens in 0.25 diopter steps till the patient reports blur. In positive relative accommodation, we add the minus lens in minus 0.25 lens. In accommodative facility, the patient sees blur and flips the lenses on clearing the target. The number of flips per minute are noted. In vergence facility, the patient sees double with the base in lens and flips their lenses when the target becomes single and clear. The normal vergence facility is 15 cycles, while the accommodative facility is 12 cycles in a minute. In convergence insufficiency, the NPC is receded and NRA is low, and the patient has difficulty in clearing the plus lens. The treatment of convergence insufficiency is the Brock string, which consists of the 3 equidistant beads. On concentrating on first bead, you see a V pattern, on second bead an X pattern, and on the third bead an A pattern. In barrel convergence card, the patient appreciates physiological diplopia of the non-fixated dot when one pair is fused. In negative lens therapy, the patient reads the near vision or the books with a negative lens and stimulates accommodation. The CAT-card test is a home-based therapy where the patient tries to converge the eye to see a complete image of the cat. In a software called the VT304 software, various vergence parameters are available like simultaneous perception, stereopsis, and the fusion. In this, the image automatically goes out and comes back in, and the patient has to make it single. For convergence insufficiency, we give the base out prism more than the base in prism. And there are various modes to make it interesting for the kids. In accommodation insufficiency, the NPA and NPC are receded and PRA is low, and the patient has difficulty in clearing the minus lens. The treatment of accommodative insufficiency consists of a positive lens therapy, which consists of the plus lens, which magnifies the image and helps to relax the accommodation. Accommodative flippers are given as a home-based therapy. In accommodative spasm, the NFV and the NRA are low, and patient has difficulty in clearing the plus lenses. For accommodative spasm, we give cycloplegics, near addition, and accommodative flippers. In accommodative infacility, we give the heart chart, in which the patient keeps changing the focus between the near and the distant chart and reads the letters on the chart. I hope you enjoyed our eye workout. Thank you.